Okay, before we go on with the next step, I want to bring my Vinicomp bag into play, and I want to show you how it's put together. This is a Vinicomp bag, which is a volume measuring device. And it's simply just open up the end, put my ring over the end like so, install the adapter. It's helpful to tape this too. So there we are. Now I've installed the end on my Vinicomp bag so I can adapt it to the exhalation port on the ventilator. So let's go back and do that now. Let's give him some breaths. Good. Now where we still pressuring at the same level, 20? Just keep hitting the okay. Now let me hook this Vinicomp bag to my exhalation port, if the viewer can see that. It goes right here. And I'm going to count how many breaths it takes to fill the bag. Are you counting? 3, 4, 5, 6, 7, 8, 9. 9 breaths to fill the bag. Okay, so now if we look on the scale on the bag, we can look for the 9. And 9 is 533. Effective breath or not an effective breath? Not effective? Why is it not effective? Not deep enough? You're correct.
Depending on the patient.
You're correct. It's not deep enough, but how deep a breath do we want? Well, typically, I think most materials say between 10 and 15 milliliters per kilo of ideal body weight. For many people, that's over 1,000, perhaps 1,100, 1,200 cc's tidal volume to have an effective volume. So the question then becomes, if we have this machine set with a sensitivity of -2, a peak flow for comfort, and a peak pressure of 22, what is going to give us more volume? And the answer is pressure. The pressure volume curve. Turn up the pressure, get more volume. Let's try. Go ahead, give me, let's go up by 5. I'll bring the camera in a little closer so it can see. All right. I'm going to adjust the setting here on my right. What are we hitting now? Why don't we just go ahead. That's about 27 right there. Yeah, so we're hitting about 27 now. Let's get our Vinicomp bag and do this procedure again. Okay, I'm going to crunch my bag close so there's no volume in it. Okay, if you'll do the honors. 1, 2, 3, 4, 5, 6, 7, 8. How many was it before? 9. So at 8, it's now 600. So by going up by 5, depending on the patient's lung compliance, that's the determining factor at how much pressure it's going to take to get an effective volume. For example, if you have a patient with normal lung compliance, you might easily achieved a therapeutic volume of over 15 mils per kilogram, easily with 15 to 20 pressure. Patient with poor lung compliance, like many of our patients that get breathing treatments, and those patients with lung pathology, it may take much higher pressures to get therapeutic volume. So, how much volume should we? Well, we said 15 mils per kilo, but how high of pressure can we go up to? So let's say we started at 20, not enough volume. It was 500, so we turned it up to 25, and we only got 600. So then we turned it up to 30, and we got How high can we go? How high is safe to go on the pressure on IPPB?
I think on the 60 or 60.
Well, a lot of the materials, and it depends on the book you're reading, but many materials seem to indicate that the cutoff being 35 centimeters of water pressure. Do people go higher than that and give effective IPPB? I think they do. There is some evidence to suggest that pressures over 35 could, in fact, cause barotrauma or volutrauma to the lungs. So check with your various reading materials and check with the policy at the particular hospital you're working as far as that. But I think you'll find that a lot of people feel that 35 centimeters of water is a good stopping point. So what if you have not achieved your volume at 35 centimeters of water pressure? Then what? Well, you might suggest talk to the physician, talk to the pulmonologist, and talk about, discuss this with him, talk about perhaps other options. The goals of IPPB as a volume expander and to reverse atelectasis, you may be able to achieve those goals in other means, perhaps. So, to review, the knob on your right is the pressure, controls your pressure. You will first set it by putting your thumb over the end. Don't hand it to the patient before you know what the pressure reading is going to be. Use your gloved hand over the end of the, I just take the mouthpiece off and use your gloved hand to slowly put your thumb over the end and watch the pressure on the gauge here to see how it rises. So know what your pressure is before you hand it to the patient. Once you hand it to the patient, you can set your sensitivity, which is on your left. And of course, you can't set your sensitivity until you have a patient on sucking on it, so you can find out how far back they're pulling. Finally, the peak flow set to comfort. Once you have the patient started, measure the volume with a Vinicomp bag. Turn the pressure up in 5 centimeter increments until you achieve therapeutic volume, or until the medicine runs out. And Okay, one quick troubleshooting. Let's say you have a situation where the machine cycles on. Machine cycles on, and it doesn't cycle off. It runs and runs and runs. What's the problem? Well, the most common problem for a machine, because this is a pressure cycled ventilator, right? So in order for it to cycle into exhalation and for this valve to pop open, it has to reach that pressure. So let's watch the gauge. This gauge is not reaching the set pressure of however we're set. Why? Because we have a leak. In fact, look at my exhalation valve. It's disconnected here.
Yeah.
I connected it. So some of the most common sources of leak are here at this device, either at the nebulizer or at that. We must have tight connections there. We must have tight connections here where it connects to the machine. And finally, and most importantly, the interface with the patient has to seal their mouth well around probably the most important thing you do, and we've really only stressed here, we've really only stressed how to work the machine. Another very important topic is what you tell the patient and how you instruct and coach your patient to do this. And some of the things that you'll tell them is to keep their mouth sealed tightly around the mouthpiece, to take a slow deep breath, to not let their cheeks puff out when they to keep their cheeks stiff and not let their cheeks puff out while they take their patient. Don't blow back against it. Don't put their tongue inside the mouthpiece. So how you coach your patient is just as important as how you work the machine if you want to have an effective treatment. In fact, I think a classic MBRC question is that the most effective factor in, or the most critical factor in effective IPPB is your knowledge about how to do it.